Yes. 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 Yeah, Prem Gaikwad. So all of you write down your problems, especially with part C. At the bottom on the left side, there will be a mic-like picture. Click on that and say Wi-Fi, connect Wi-Fi or connect audio. Connect to network. Audio over network or something will be there on the mic. Okay? Okay, fine. Yeah, but you are not able to hear, no? Frame like what? Yeah, you are connected. Yeah, you connected with a mobile or laptop. Okay, fine, fine. That's okay. That's okay. Yeah. Sorry. Yes. Okay. So all of you write your problems with part C, listening subtest. All of you write your problems with listening part C subtest. I'm giving you 1 minute because we learn a lot of parts. If you want, we can get a 2, 3, 4, 5, 6 also. As many as possible. If anybody is interested, then we'll see as many as possible. Write down your problems regarding for yes. All your problems. Write down all your problems. I want you to discuss, share your problems. Yes, all of you share your valuable points. Okay. Yeah. And yes, the points which we are going to discuss are those things which I have not discussed earlier in this 1 month. Yes. Now go through these questions. We are going to discuss all these questions now. Then only we will do the listening, continuous listening. Analyze carefully and see after that I'm going to explain or demonstrate. So read this one first. Part C. Question after question will go now. Find out the secrets in identifying the answers here. Yes. Now let us see, read the instructions here. First, only instructions we will see. Now, if you see, you hear a general practitioner. So the person who is speaking is a general practitioner. The person who is speaking is a general practitioner, and her name is Elizabeth Walker. So she's a doctor. So now you have to understand like this. So you hear a general practitioner, Elizabeth Walker, and she is giving a presentation. This is a presentation regarding child health and well-being. So now you have to try to understand this. This is very important. This is very, very important. So let us analyze the points here. This is who? 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 Right. Number one. Okay. So this is who? That means actor. Right. And what is she doing? What is she doing? This is the purpose. Okay. Right. And about what? This is the title. This is the subject. What is the subject? Or what is the topic? About what? So, about what? So that's it. Now here, who is doing what? About what? So these are the important things that you have to focus now. So who is the person? Elizabeth Walker. And who is Elizabeth Walker? A general practitioner. So remember that. What is she doing? She is giving a presentation. She is giving a presentation. What is the subject of the presentation? General health and well-being. General health, sorry, child health and well-being. So this is about children. This is children. Remember that. This is about children. So this is the background history. This is the background history. Remember that. This is the background history. Yes. Right. Now focus mainly on this. This is very, very essential. So, who is doing what about what? She's giving a presentation, she's giving a demonstration, she's going to explain, she's going to tell, she's going to motivate, she's going to encourage, she's going to present an idea, she's giving a clarity about a particular subject. So it may be any way. She's explaining, she's making them understand because maybe they don't know. So she's giving a lecture. So how to analyze these things now? The topic is child health and well-being. The topic is child health and well-being. This is what is very, very important. Good evening, Constance. So this is very, very important. Now, if you can understand these things, then only you can go to the questions. First, try to understand these questions because you will have some time to read these questions. You will have some time to read these questions. Okay, you will have some time to read these questions. Right. So, Elizabeth Walker. Now, why is this Elizabeth Walker giving a presentation about child health and well-being? Because she is an authority over the subject. She has mastered the subject. She has wide knowledge. She has expansive understanding. She is immensely powerful in this particular area or specialization. She is a general practitioner. So why she is giving, for example, why I am giving this lecture? Because I am an authority over this area or this specialization. That's why I am doing. You cannot give this. You are only a recipient. So the powerful person will give information to the less knowledgeable person about that particular subject. So try to understand. So they need this information. So you have to learn this style. Then you can attribute to every listening. I'm giving you a lecture in such a way that you can use this information, this style in every individual lecture skill test of part C. Because part C requires spontaneity, urgency, immediate response, on the spot, without any delay. You have to catch and hit the wicket. That's it. So if you miss at that particular juncture, you will lose the answer. So you have to be always alert. You have to be always alert. You have to either catch or you have to stop the ball and hit the wickets. That's it. So now here, every question deals with one particular paragraph. This is not a reading paragraph. This is a spoken paragraph. Right. There are two types of speaking. One is a dialogue and one is a lecture. A monologue. Dialogue is an interview and monologue is a lecture. Monologue, mono means one person is speaking. Only one person is speaking. That is the monologue. Right. When only one person is speaking, that is a monologue. Remember these things, whichever I am telling you now. I'm going to teach you about monologues and dialogues also. That means a lecture and an interview also. Right. Now, let us see here. This is enough. 31 to, yeah, that's fine. Don't miss, okay, the show. Right. Now, question number 31. Focus on this particular area. Focus on this particular area. Okay. Now, here, this is common. So, don't focus on 90. Focus on whether it is 5 or 2. 95, 92. 90 is common. 90 is common. So try not to focus on this particular area. So you have to listen for these particular things. You have to be ready to listen to these particular things. Is he telling about 5 or is he telling 2? Okay, even percentage is to be eliminated. Is he talking about 5 or are you able to hear the word letter 2, word 2, or focus on 8? So 5, 2 and 8. You have to focus on this particular spot. If you miss it, you're lost. 80. 0 is not pronounced. So 80. So 8, 5 or 2. These are the locations which you have to focus on. So according to Dr. Walker, what are vaccination rates? Rates means percentages. We know that. What is the rate? So this is not needed because this is also common. This is also common. So no need to focus on this one. No need to focus on this one because this is common factor. Commonality factor. So is it 5 or 2 or 8? So these are the 3 numbers that you have to focus on. Yeah. Is it a 5 or is it a 2 or is it 8? Yeah. These are the 3 numbers. One of these 3 numbers only will be your most important one. So focus on these 3 numbers. I told you already. Okay. I told you already very important things. I'm going to tell you the sharp or the dark secrets of listening. Elimination technique. Priority based elimination technique. Yes. I hope you understood these things. Now, next let us see the second one. So 82. Question number 32. Throughout the, okay, here you have to focus on the word vaccination. When you hear vaccination, number one, but here you have to think about something else. Is he talking about urban areas? And is he talking about England? You focus on these words also. The topic is vaccination in urban areas and England. Vaccination, urban areas, and England. So these are the three things which are very, very important for you now. So you have to think about vaccination, okay, and urban areas and England. These are the three things you have to focus. Okay. If you hear these three words, first he will start with vaccination and he will talk about England and he will say about urban areas. These three things should be included. He may say rural areas. He may say many rural areas. He may say instead of England, he may take New South Wales. He may talk about Ireland, England, Scotland, Ireland, and New South Wales. He may talk about all these four things. Maybe. He may talk about the all of United Kingdom, maybe. But in specific, you need to listen to England. The word has come or not. And you have to hear the word vaccination. And you have to hear the word urban. It's a must. These three words are a must. You have to be catching ready for this. Once you are ready, your ears should be sharp. Any one of these words comes, your ear should be sharp. Right. Next. Second one. Throughout the year 2010-2015, yeah. Throughout the year 2010-2015, when this year comes, this topic is about vaccination rates. So the first topic, the first paragraph is about, I'm talking here very clearly, there is nothing secret. The first paragraph is about rates. Rates. The first paragraph is about vaccination rates. Vaccination rates. So what proportion? This is about statistics. Rates or figures, statistics. Vaccination rates, you can say. The next one. Yeah. Everything is, this also is statistics. Okay, fine. This is about vaccination rates. Now, next one. This is about throughout the year 2010-2015, he has come to a limited time. Has come to a limited time. Right. During this period, so he will say the first half of this particular decade, 2010 to 2015. Okay. So this 5 years period. Right. How many patients? How many patients has or have? How many patients has or have? Okay. How many patients have the average health visitor caseload reduced by 1 minute? The question is not set right. Okay. Let me set it right. Throughout the year 2010 to 2015, how many patients have the average health visitor caseload reduced? Why is not needed? How many patients have the average? How many patients? The number of patients is asking the number of patients. How many patients? Okay. Have the average health visitor caseload reduced? That's it. Fine. So focus on this particular area now. So year 2000, 2015, when you get this one, be alert. He is asking how many, means he wants the number. Okay. He wants the number. He wants the number. He's asking, sorry. He wants the number. How many? How many? How many? 400, 120, 280. 400. Focus on these areas. 400, 400, 120, 280. That's enough. You check in the hundreds, that is enough for you. You check in the hundreds, that is enough. 400 or 100 or 280. That doesn't make any difference. 100 is 120, 200 is 280, 400 is 400. So if you catch the hundreds figure, that's enough. Okay. Hundreds figure you catch, that is enough. 400, 400 straight away. 120, 100 is equal to 120. There it's very clear now. And 200s is equal to 280. There is nothing else. So no need of any confusion. Check the hundreds, the first figure. There's a clarity. That's a clarity. Okay. So the number will be in full. If you say 20, it will be not a 2, it will be something different. So no confusion. So the hundreds figure to take, that's enough for you. How many patients has the average health visitor caseload reduced? That's enough. So 400 or 120 or 280. So throughout the year, he may talk about the first half. Throughout the year 2010, 2000. Oh. Throughout the year 2010. Throughout the period. It's not 1 year. It's throughout the periods. I don't know who framed the questions. Okay. From 2010 to 2015, during the period 2010, during the period between 2010 and 2015, you can say during the period between 2000 and 2015, or the question is not framed properly. We don't mind that one. We have to set it right. Throughout the period, you can use between 2010 and 2015, or from 2010 and from 2010 to 2015. From to or between and. You have to use these two collocations. That's all. Okay. Throughout the period from 2010 to 2015, or throughout the period between 2010 and 2015. So that part, there is a mistake. And in the second part also, right? How many patients have the average health visitor caseload reduced? Okay. So this is the way how you have to ask the question. Right. Now try to understand. Average This also you have to listen. Average health visitor case load. So if it is reduced, this also is important. Sometimes it may be reduced, it may be increased, or it may be status quo, remain the same. It may be increased, or it may be reduced, or it may be remain the same. That's it. Right. Next. Yeah. Yes, sir. Thank you, Chaitra. I received your payment. Thank you very much. It was of timely sent. Really, I'm asking you. It was really timely sent at the beginning of the month, and you have sent in right time. Thank you very much. And those students who have to pay the pending fees, please send without me asking you personally, because I'm a teacher. Okay, I deserve my respect. I need not ask you, send my fees, right? So as you promised, you have to send it accordingly, because I'm a teacher. If I am your teacher, where is my reverence? And if I am your father, where is my respect? So that is very important, because you are my children. I tell you, you are my children, you are my children, you are my children. It means a lot to me. The sentence means a lot to me, because if you are my children more than my students, that means I give you out of my heart, not just as a matter of teaching. I give with a lot of dedication. So remember that one when you have to pay your fees to your teacher, right? Yeah. Fine. Yeah. So this is the second point. This is the second point. So focus on either 4 or 1 or 2. Right. That's it. So you have to hear 2010, 2015. What should you hear? You have to hear these particular things. Okay. First one is this. Okay. So you have to hear this 2010, 2015. Then you have to hear this average health visitor case load and reduced also. It may be reduced or increased. Sometimes it may be reduced, sometimes it may be increased. Some did not change at all. So these are called trends. Increasing trend, decreasing trend, and remain the same trend. And there is another trend called fluctuating trend. Trends may be 4 different things. Trends may be 4 different things: increasing trend, decreasing trend, remaining the same trend, and fluctuating trend. Right. And now the third question. Third question. Dr. Walker suggests vaccination should not be provided to an infant before the age of. Dr. Walker suggests a vaccination. So he's talking about vaccination, and he's talking about prohibition, avoiding, refraining from. Should not be provided. Should not be provided. Okay. Provided? No, should not be provided. So try to understand this one. To an infant before the age of. So he's talking about an infant, children, not children. He's talking about a particular level. Infant below 2 years of age. 2 years of age. Children below, there is somebody who has written 4 years infant. Oh, 4 years, how can it be called an infant? Okay, you can say child. 2 years, less than 2 years is an infant. Okay. Before the age of, before is talking about the age of, what age? So, now try to understand here. Number one, you have to see whether he's telling weeks or months. So try to understand here very carefully. Is he telling weeks or months? If he's telling 8, that is compulsorily weeks only. So here there are 2 things which are mentioning weeks. This is also weeks and this is also weeks. If he's telling months, okay. If see here very carefully what I'm telling you here. I'm going to fit you tightly here. The screw, we have to fit it tightly. Screw tightly, otherwise there will be a damage to any heavy object. If the screws are not fit tight, there will be a serious damage. Remember that. Okay. So now, first thing is, you notice one thing here. Is it weeks or months? Is it weeks or months? You have to notice that one. Is it weeks or months? So if it is months, it's a straight away B. Right? So try to understand this one very carefully. What I'm showing you here. So I'm segregating the point here. Yeah. I'm going to show you what the difference is. Yeah. I'm going to show you a totally new concept here. How to see the bifurcation of the question. Yeah, good evening, Anesthesia, Constance. Okay. How to check the bifurcation here? Okay. Is it weeks or months? Right. Now let us see. If you see here very carefully, you will be able to understand what I'm going to show you now. This months is directly B. Right. If months, then directly B. If you hear the word months, that means the answer is B. Sorry. If you hear the word months, the answer is directly B. Okay. Do not, refrain, should not be provided, should be avoided, refrained from giving the injection. The question may come in different way there, but you have to identify what he's talking. Months is months, that is straight away B. The next one, is it 8 or 6? 8 or 6? That also you have to see. Is it 8 or 6? This is another concept now. This is a double game. This is actually a double game. He's playing a double game here. Many people will get confused here, too much confused. So if you see what he is trying to mess you up with, so you will fix him up properly. Now here, 6 and 6, 2 times are there. If the word is 8, then it is directly going to, if the word is 8, it is directly going to A, because only one 8 is there. Remember that. Only one 8 is there. Let me change the color. Only one 8 is there. If only weeks, only months, it is B. If only 8A, if both, okay. So try to understand. So weeks and so 8 is here. Eight is here. Okay. So right. That's it. And months is here. Right. So try to focus on these things. Okay. Then if weeks and 6 both are there, try to understand how I am showing you. I already told you he's playing a very double game. Okay. 8 is, 6 is there. And weeks is there. Okay. 6 and weeks both are there. Then that's it. You listen for 8 or 6, both you will be listening. But is it months or weeks? Both you have to focus. Now what you have to do is, when you are hearing, what you have to do is, yeah. These 2 things you have to focus now. 8 or 6. You have to make this number and make these 2 things. Right. So when you hear, you should tick. If you hear weeks, tick weeks. If you hear months, tick months. If you hear 8, tick 8. And if you hear 6, tick 6 here. That's it. Very clear it is. Very, very clear. So you have to tick the answers. You have to write like this, weeks and months, and 8 and 6. Then your answer will be very clear. So this is called preparing yourself for the question. Now, if you hear weeks, you just click weeks. If you hear 8, you click here 8. So 8 weeks becomes this A answer. Now next. Now next what you will click, if you click months, okay, and you click 6, then it is 6 months. B is the answer. Okay. Then next one. You click 6 and you click weeks, then C is the answer. So you have to mentally make some map here like this. I hope you understand what I'm telling you. Right. If these 3 questions are understood, okay. My question now, I took a lot of time to explain these concepts. How to analyze the question, because these are very important in the first 30 seconds. That means each question you have 6 seconds for each question. So analysis of these analysis of the first 3 questions. Clear? Yes or a no? If it is clear, you say yes. If it is not clear, say no. Please. I took a lot of pains to explain those things because everyone says we have problem with part C. Everyone says we have problem difficulty with part C. Everyone says there is confusion. Everyone says there is diversity. Everyone says 2 questions are we are able to feel they are right. Then why don't you say yes or no now? The concepts are clarified. If it is clarified, say yes. If it is not clarified, then let me know so that I can explain you further. Please. I already told you I'm a teacher, okay? When I say something, just give me the information that will only help you. Yeah. Yes. So majority of you have given a yes. YO. Can you please type your name? I just want to know. So welcome to the channel. Welcome to our sessions. Right. So we can move to the second part now. Clear all drawings. Okay. So these are the set of questions now. Yeah. Yes, 3 questions. Yes, go through these questions for a minute. Actually, this is a very easy question paper. A lot of statistics are there. Numbers are very easy. Right. Yeah. So now he is going to US. Now we are going to US. How many means number? People were killed from diphtheria in 1 year in the US. Diphtheria is talking about diphtheria now. And were killed. How can it be killed? Died. How many people died? Why were killed? Who killed? Eh? Who killed? They died. A question paper, I don't know, there is some sort of confusion because you can see how many people were killed from diphtheria? Huh? Don't you see? Don't you reason? How many people died? Okay. People died of disease, not killed from disease. Died from disease. Killed by somebody. Killed by somebody. Or killed by something like accident. Killed in an accident. Okay. Fine, no problem. Let's not bother about that thing. But let us bother about our own things. So how many people died from diphtheria in 1 year in the US? So focus on these things. You have to hear the word died, not killed actually. Okay. Diphtheria is the name of the disease you have to hear. And only in 1 year, this also you should remember, in the US. So what is the number? You see here. So now commonality, eliminate the commonality. This is common. This is common. Right. Now let us see here how you are going to pronounce these words. Okay. How you are going to pronounce these words. Here 1, 5, you are not pronouncing it as 1. You are pronouncing is 15. 15. 15. So you are pronouncing it as a whole. 15. We need not bother about 1000 here. Take it as 15 as a whole. Take it as a whole. And here 175. So 1 is enough. 1 is enough. 175. Here it is 15. Here 100. Here 15,000. 15,000. So 1000. Here 175,000. 0, 0, 0. 1000 is common. So 0, 0, 0 and 0, 0, 0 are common. So 1000 and 175,000, 15,000. So thousands we eliminated. Only 170. 100 is enough. And this is 15. And this is no one, none, nil. No occurrence, no death because of diphtheria. Killing because of diphtheria or death because of diphtheria. So when you are writing, okay, be careful. That is called collocation. Okay. Can people be killed from diphtheria or people die from diphtheria? That's called collocation. Die goes with the diphtheria. Okay. Right. Next one. What? Okay. That's very clear here. 0, none, nil, no, never, not, nobody, no one died. the figures or not. So like this, not means nobody, zero, null, nil, all these. Not means nothing, zero. Yeah. Next one, second question. Okay, we have seen this first question now. So this is about US. Then again the topic is changing to UK. So try to understand very clearly here. These are paragraphs. This paragraph is focusing about diphtheria in US. And this paragraph is talking about diphtheria in the UK. Statistics of diphtheria in US. So this is the topic. US is the topic here. This is UK is the topic here. Now focus on this one. What was the average number of diphtheria cases annually? Average cases. Here also diphtheria. So diphtheria has already started and is continuing from US to UK. And here you have to see annual average during the 21st century. 21st century means 2001 to 2100. That is 21st century. Okay. Right. Now here you see what figures you have to focus. So again eliminate 1000, 1000 and 1000. Eliminate. Now see the pronunciation of these things now. If you start here, you will start with 5. Say 500. You are saying here 500. 5. The first letter is enough for you. 500,000. 5. So 100 is common here and 100 is common here. No problem. So listen to whether it is 5 in the beginning or not. Or 1. 175,000. 1, 5 or 1. And here you will hear it as a whole, 15. Is it 5 or 1 or 15? Focus on these areas. 5, 1 or 15. That's it. Focus on these particular areas. No need to hear the full number. 500,000, no need. If you hear the word 5, that's distinctly A. If you hear the word 100, 100 or 100 or 100 or 175 without 5 or without 15, then it is B. The next one, if you hear the word 15, that is C. Minute expressions, utmost clarity. Yes. So focus on these rounded figures. Those sounds only. Right. And be careful. Sometimes the difference between 50 and 15. 50, 15. There's a short vowel and there's a long vowel. 50 is a short vowel. E. F-I-F-T-Y. 50. So there is no difference between fifth. The last sound will differ. E or E. If it is a long vowel, then it is 1-5. If it is a short vowel, It's 50. 50. There is a lot of difference between 50 and 15. Clarification. I'm giving you a lot of things I'm telling you because whenever the statistics are there, 1, 5 or 50. Now to be clear here, this is FIFTY and this is FIF GEEN 15. Now let us see very clearly here how I am eliminating the sounds. This is commonality. Okay. Now regarding which sound you have to focus now, I'm going to show you the sound that you have to focus on. Is it E or is it E? So this 15 is a prolonged sound, E, and 50 is a short sound. So you cannot identify here. You can identify in the pronunciation only. E or E. Focus on this particular sound. Otherwise you are lost. Many times he will be testing for this. Whether you are able to understand the sound very clearly or not. Who wants your answer A, B, C? Nobody bothers. He's testing your pronunciation here in this case. Be very careful. 5 and 5th. A is 5. Here 5 and 5th. This is somewhat better. But this confusion will kill you, ruin your mark. Unless and until you go through these two sounds. E or E. That's very, very important. Right. Next. That's very clear. Actually, I should have written here, but it came here. No problem. This is sounds. Okay. Now coming to the point. Which side effects? Which side effects of the vaccine? The same vaccine. Which side of it of the vaccine does Dr. Walker not mention? Not mention. That means you have to eliminate the two things which he mentions, because you will not hear the reaction which he does, the side effect which if he doesn't talk, if he doesn't mention, how do you know? If he doesn't mention, how do you know? He did not mention in the speech. He did not mention in the speaking. He did not mention in the 6th audio paragraph. These are about the side effects. This paragraph is about the side effects of vaccine. This particular paragraph is about the side effects of the vaccine. So these side effects, okay, these side effects, 2 side effects he is mentioning, maybe 5 side effects he is mentioning. Out of them, 3 are given here, 2 are given, and 1 which he did not mention is given. He may have mentioned 2, or he may have mentioned 3, or he might have mentioned 4 or 5 or 6 or 10 side effects he might have mentioned. We don't know, but it is definitely 2 or more. So you have to hear them and you have to tick mark 2, which is already mentioned, and which is not mentioned is into mark. That into mark. So he will be mentioning, don't wait until he tells everything. You listen. First of all, he is mentioning about pain, joint pain or muscle pain. Tick it. That means he mentioned. That means he mentioned. Don't play the fool with the bullet points. Tick here. Then if he mentions weight gain or increased weight, you put here. And this is into mark. That means he did not mention. That means B is the answer. So shared B. That's it. So this is the technique you have to apply. This is called elimination technique. You have to eliminate the two options which he has mentioned. Yeah, good evening, Pranita. So you have to understand, you have to listen very carefully. Okay? You have to listen very carefully. Okay? He may say, they did not lose any weight. That means that is not a problem at all. They lost weight means a problem. They gained weight. Okay, then only you have to say lost weight is not a problem here. Okay. The next one, muscle and joint. So you have to focus on what areas? You have to focus on these areas. Number one, weight. Number two, you can think about muscle or joint. Anyone you hear, that is enough. Okay. Or you can even think about pain. Or you can think about anaphylactic. So these areas you focus. Tick mark those two he has already mentioned and eliminate that one, those two answers, and the remaining answer is the right one. So this is the way how you have to answer. Yeah. So this analysis is very important in the 30 seconds. How will you do in 30 seconds? Start from now. By the time of your exam, you can do it. Okay, if you have 10 days of practice like this, you will definitely get to the roots of the problem. It is no more a problem. Yes. So now I'm asking you the question. So second 3 questions. The final 3 questions. Concepts. Concept check question, CCQ. Okay, concept check questions. Clarity achieved. Yes or no. Just to type yes or no. Yeah. Please, first. YO, Y3. Did you type your name? I asked you. Second time I'm asking. I will not ask third time. Next time, if it is not there, okay, I cannot permit you to continue. All the students should be with a name here. YO, Y3. I cannot call you YO, Y3. If you are not going to get your name within the next 5 minutes, I cannot help you, please. YO, Y3. I'm asking you to submit your first and second names. Yeah, anesthesia Kelechi. Okay. Yes, that's it. So because most of them will be regular students, I have to know because I did not invite many students today. Okay. I invited only regular students. Okay. So now I'm going, this is the lecture for my regular student, not for everyone. This is the lecture for my regular students. Okay, now I'll invite others. So you have paid the fees, you deserve this. That's why I'm giving you. So I should know who they are. Okay. Otherwise, I'll not even allow them to come into the class itself. Right? I'm working very hard for you. Okay, because you pay the fees for me. So please let me know you that you have are attending the class. Okay, come with your names, all of you. Right. So now clear all drawings. Okay. Now shall we go with the audio? Shall we move further? Yeah. Yes. So are you ready for the show? Yeah, 1, 2, 3, 4 students are ready. What about the others? You need some time? Yeah, that's good. Yes. So we are going to play the audio. Yes, Aruna Madhurya, you missed the session. Okay, very important session it was. So what you can do is you can go to the YouTube or ask me the link to go and listen to it again afterwards after the session. So that is what I can tell you because I cannot explain it again. I know, yeah, for you people only it is there. I'll give you the link. Yeah, I know you have joined only for reading and listening, and you have already paid 7,000. Okay, I know that. Okay, for that reason, I preserved the audio, preserved the video for my regular students who miss the classes. Yeah, because I'm going to take a lot of sessions today, special sessions, because there are students who are going for the exam on the 13th of May. Right. So ready. Now I'll invite the guests. Let them come. So those students can just come and participate in the test, not in the lecture. Yeah. So we have two more places. If anybody is there, nobody is there. New students. See? Yeah. Only one is that Adira. Adira Ajmon. Yeah, Adira Ajmon. You can attend one listening session and one reading session. Afterwards, you can register for the course if you want to attend the regular sessions. So welcome to the channel. Yeah. Right. So go through the questions now. I'm silent. I'm silent for say 1 minute this page, 1 minute that page. Actually 30 seconds for both the questions. But just think like how I thought you think, you analyze. Learn how to spend time, valuable time carefully in a result-oriented manner. When you hear the word US, you have to come to this question. When you hear the word UK, you have to come to this question. When you hear the word side effects, these are called as pointers. These are called as pointers. US, UK, that means you are going to the next question. When you are hearing the word side effects, that means you are coming from here to here. When you are hearing the word UK, you are coming from this question to this question. Focus on that particular question. When you hear the word US, focus on 34. When you hear the word UK, concentrate on 35. When you hear the word side effects, concentrate on 36. That's all. These are called as question turners. I am coining a new word, question turners. You are turning the question from here to here. So here it is England. It is England. Here it is the word caseload or 2010, 2015. Here it is England. That no problem. From this question to this question, 2010, 2015 years come, you have to go here. Then infant, not be given an injection. Infant, from child to infant. Okay. So then you will come here. So then US, then UK, then side effects. Right. So now let us play the audio.
Occupational English test. Practice test.
About it the other day. Where did I put it? Oh, here it is. So it says
very closely with a lot of other healthcare professionals.
Now look at question 4. You hear two nurses discussing malaria.
About it the other day. Where did I put it? Around 7 to 18 days. Then the symptoms start to develop.
What are the symptoms?
It says the symptoms include high temperature, fever, sweats, chills, headaches and vomiting. And of course, you know malaria is fatal, right?
What? There are vaccines though.
True. The article recommends taking anti-malarials at
I wanted to discuss leptospirosis or Weil's disease in dogs. Canine leptospirosis or lepto can be asymptomatic, making it difficult to detect. However, when symptoms do occur, they include fever, vomiting, loss of appetite and lethargy. It's not a new disease, it is actually quite ancient, but it is being detected more frequently due to advancements in technology and improvements in diagnostic skills. Lepto is zoonotic. Which or lepto can be asymptomatic.
Around 7 to 18 days. Then the symptoms start to develop.
What are the symptoms?
And their bite injects parasites into the circulation of the host that causes the disease.
Yikes.
Absolutely yikes. The parasites travel in the blood, first to the liver where they mature, and you wouldn't even notice it because there are no symptoms for around 7 to 18 days. Then the symptoms start to develop.
What are the symptoms?
It says the symptoms include high temperature, fever, sweats, chills, headaches and vomiting. And of course, you know malaria is fatal, right?
What? There are vaccines though.
True. The article recommends taking anti-malarials at the right dosage and finishing the course before you go, plus a consultation with your GP is standard.
I'm starting to have second thoughts.
Now look at question 5. You hear a vet discussing a new cure. Now read the question.
Means it's hard to know which strain is actually affecting the dog, and so a strong adjuvant.
You'll hear a pharmacist discussing a new drug.
So a strong adjuvant is added to elicit a response. This can carry a greater risk of adverse side effects, especially in animals that are older. There is a cure, but making sure your animal has a healthy immune system and lifestyle may mean that a vaccine might not be necessary.
Now look at question 6. You'll hear a pharmacist discussing a new drug. Now read the question.
For fever or any other symptoms, please do come back and see us or seek another appointment with your GP.
Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 7 to 18, choose an answer, A, B, or C, which you think best fits according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 7 to 12. You hear a general practitioner called Elizabeth Walker giving a presentation on child health and well-being. You now have 90 seconds to read questions 7 to 12.
Hello, my name is Dr. Elizabeth Walker, a general practitioner who specializes in child health and well-being. The topic I'm here to present today concerns vaccinations and the risks children face in their immediate and long-term future should their parents choose not to vaccinate them. Vaccination rates should be at 95% according to the World Health Organization, which would allow for herd immunity, whereby a disease will not be able to spread amongst a population. However, in the UK in recent years, vaccination levels have fallen below the recommended WHO guidelines. Although Scotland, Wales, and Northern Ireland achieved the WHO guidelines as of 2016, the national rates in the UK stood at 92%, a good 3% below the WHO guidelines. In fact, in urban areas with high deprivation, that level can fall to as low as 80%. This is a worryingly low statistic and creates a high risk of outbreaks of serious childhood diseases. However, vaccination rates have been steadily improving since the year 2010 due to the restructuring of the health visitor system. Health visitor numbers throughout the years 2010 through 2015 increased by 49%. With average health visitor caseloads falling from 400 to 280 children. This made it easier for families to receive sound medical advice and thus be better educated on the benefits of having their children vaccinated. However, the increase in rates in these years has been negated by a loss of funding in the last 2 years. This has led to a slight reduction in vaccination rates. The reduction in vaccination rates in recent years can be supported by statistics from the years 2016 through 2017. There are several vaccines a child requires in the UK up to the ages of 14, and adults over the age of 65 also require certain vaccinations. A vaccine should not be administered to a child below the age of 8 weeks, as the vaccination will not work as effectively. In the years 2016 to 2017, 4 of the 6 main routine vaccinations were administered in a smaller amount than the year before. It is the 3rd year in a row that the likes of the measles and mumps vaccine have declined in their administration rate. Although the decline was only 0.2%, this is still a trend which the UK government would see reversed. The benefits of vaccines far outweigh the very minor risks. Statistics from 2006 highlight the benefits in no uncertain light. Take the measles virus, for example, which was responsible in the 20th century for an average of 500,000 annual cases. In 2006, when vaccinations were administered at a 92% mark, that rate dropped to just 55 annual cases, a 99.9% decrease. A second example that can be used is the disease diphtheria. Diphtheria is an extremely dangerous disease and once killed 15,000 children in 1 year in the USA. The average number of diphtheria cases in the 20th century in the UK was 175,000. In 2006, not a single case of diphtheria was reported all year. That is a significant piece of evidence to use in favor of vaccinations being administered to all. Side effects are uncommon, but even when they do occur, their impacts are often short-lived. The following side effects are listed on the NHS website as common: injection site reactions, mild fever, shivering, fatigue, headache, and muscle and joint pain. These usually last only a few hours, but could extend to a period of a few weeks. A more serious side effect is an anaphylactic reaction, an allergic reaction to the vaccination, which can be life-threatening. In spite of this, such a side effect only occurs in 1 in every million vaccination, and are usually easily treated and overcome. Ultimately, the benefits of vaccinations far outweigh the negatives, and the effective immunization against the likes of measles and diphtheria attest to the success of vaccination.
Now look at Extract 2. Extract 2.
Oh, wonderful. Okay. So, don't write anyone any answer. Just follow my guidelines now. Here is my role. If anybody rushes past, I remove them out of the session. Don't give the answer, because together we stand. United we stand, divided we fall. Don't prove that you are an extraordinary student. Just be one among them. Just be one among the group. Go with everyone. I want all of you follow my suggestions here. Yes. Now let us see. We are going to discuss the answers. Don't do anything. Just what you have to do is, okay. Right. Yeah. Okay, let me keep this side. Yes. Responses. Be very careful. Responses. How you have to do is, I'll tell you like this. Question 31. Yes. Then I'll count down from 7 to 1 and say submit. Then you have to submit. All of you type your A, B, or C and be ready. That's all. Don't push it. Be very controlled. Okay. Be very systematic. Be very organized. Yes. Question number 31. 7, 6, 5, 4, 3, 2, 1 and submit. Why Prem? Okay. I deleted your message. Okay, submit only one answer. Only first new student, na? New student, so that's why you don't know. That's okay. Question number 31, only one answer you write now. I deleted all your answers. Yes, that's it. This is how you have to follow. See how everyone is doing like that. It's a very different type of session, okay? A very, very different type of session. You will not see these sessions anywhere. They'll just teach and go. Here I train, I don't teach. I train. I'll sit in the pilot seat and I'll give you the steering wheel and I have a brake at my hands and I'm a driving trainer. Okay, right. Step by step, I'll be careful with you. Next one, question 32. Yes, 7, 6, 5, 4, 3, 2, 1 and submit. He will tell almost all the answers, but you have to be very careful. You have to pick and choose. Okay, reduction, he told. He did not say reduce. Reduction. Okay, so you have to remember very carefully. All of A answer is there, B answer is there, C answer is there, everyone. That means there is a lot of confusion in this question. So that's it. Right, very good. I love this question. Yeah, you have to be very careful in such questions. Question 33. Yes, 7, 6, 5, 4, 3, 2, 1 and submit. Wow, there is no confusion here. All of you submit. Then question number, yeah. Question number 34. 1 second. Yeah. Seven, 6, 5, 4, 3, 2, 1, and submit. Then we have question number 35. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. Question 36. 7, 6, 5, 4, 3, 2, 1. Submit. Yeah. Now what you have to do is, I'm going to show you the answers now. I'm going to show you the answers now. Okay. Right. So you have to check your answers and you have to update your scores. Okay. Now let us see. Yes, part C. Question number 31 is C. Question number 31 is C. Update your scores, please. Every 1 by 1, okay, or 0 by 1. 0 by 1 or 1 by 1, like this. Update your scores. No problem. 0 or 1 also no problem. There's no problem at all. Update your score. Yeah. Right. Then next one. Question number 2 is B. If it is right, yeah. So write, update your score. 0 by 2 or 1 by 2 or 2 by 2. All of you should get A grade or B plus and prove who is Simon sir. Okay. Yes. And next 33 is A. Yeah, update your score. 33 is A. Yeah. Next, 34. What are the other questions? Okay. 34 is a C. Update your score. 34 is C. Yes, next 35 is B. Yeah, you can update your score. 35 is B. And last one is 36, that is A. Final update. Yeah. Yes. So now let us see the winners for today's test. The winners for today's test are, yeah, let us see from here the beginning. Manjula Ravikumar. Okay. Number 1. Manjula Ravi Kumar. That is number 1. Okay. Then number 2. Number 2 from the beginning. Manjula Ravi Kumar. Then Meera Manoj. Number 2. Meera Manoj. And then number 3, Pranita. Wow, Pranita. Good. Pranita Pamarti. Number 3 is Pranita Pamarti. And number 4 is Constance Marfosa. These are the 4 winners. These are the 4 winners. The winners of today's. Okay. Test. Yeah, just congratulate them. These are the winners. Yeah. Just write one word, whatever you want to write. Yeah. Somebody clapped their hands, somebody said congratulations, very good. This is how we have to encourage one another. Then next one. Then let us see out of, okay, runners. Runners up. Okay. Runners up. Runners up are, if anybody is missed, let me know. In winners. Yeah. Runners up. Okay, 5, 6 by 6 Manjula. Adira Ajimon. Number A. Adira Ajimon. So our guest today, very good. Next one is Aruna Madhurya. B. Aruna Madhurya. She did not attend the initial session. Otherwise, maybe she would have got 6 out of 6. Good. Next. Next, who is the Aruna Madhurya? Next one, Chaitra Gowda. Chaitra T-H-R-A. Gowda. Chaitra Gowda. Yeah. Chaitra Gowda is the third one. Then after Chaitra Gowda, there is Prem Gaikwad. Number 4, D. Prem Gaikwad. Yeah, GAE or GAI, I don't know. One time you write GAI, one time you write GAE. In my WhatsApp, you wrote GAE. And in the internet, now Zoom, you are is GAI. So I don't know the correct spelling. Okay. Number E. E is, who is this E? YO. Who is this YO again? YO, some name was there. YO. Anesthesia Kelechi. Okay. E is Anesthesia Kelechi. So E, 5 runners up. Manjula says, I'm very confident in part C. Wow, that's good. Why don't you write something? Nah? Congratulate these people, right? Huh? Congratulate these people. Right. Next, second runners up. Second runners. So anybody missed, you let me know. Right. Amrita. Okay. Let me see from here. Manjula, then Meera, Atira, Nang, 4 by 6. Amrita Devi. Okay, this is so all AA. Amrita Devi. Amrita, single T. Okay. Amrita Devi. Right. Next, anybody else? Yeah. Right. Okay. Blessing your Simba, you have to work hard. No problem. Yeah, that's it. I don't know, some students did not give their marks. That's okay. Here is your teacher, proud of you. Wow, wonderful. Right. Now I want you to give your feedback regarding this particular session. Feedback for this session. Please. At least if I say please, some people will melt and give. How do you feel? I also need to know that you are happy with this session or not happy with this session. Whatever it is, right? In your own words. Give your feedback. How did this brainstorming session help? Brainstorming session. It's not brainstorming session actually. It's not brainstorming session actually. Yeah. Yeah, Meera, definitely. You can select one session and give me. I just randomly, today I explained a full session, that's all, full test. I did not see whether it is easy or difficult. I just explained like that. So what you can do is you can select and you can send me on test, then I'll definitely give. Anybody, not just Meera, anybody can do that one. Write your own, yeah. How was the techniques? How were the techniques? Techniques helped or not? Techniques help. Strategies. Okay. Strategies. Or you can say methods. Approaches. Yeah, tomorrow we can do those things, no problem. Test number 12. Yeah, Tira, you have one session for reading, one day. Reading. Today you attended listening, tomorrow you can attend the reading. So, or maybe today is already 11:30. What you can do is you can focus on, tomorrow we'll see how to focus on these things. Don't go, okay? Don't go, all of you. Yes. So I'm giving you a chance to unmute one by one. Yeah, Danya. Okay, good. Right. Now, first one, let us give to our guest, Adira. Yeah, Adira, you can unmute. You can speak about your experience. Everyone will talk now. They'll share their experiences. So you can tell about yourself. Where are you from? What is your profession? How did you experience this session? Yeah, Adira.
Yes, sir.
Yeah, you can share your experience. Where first you introduce yourself, where you are from, about your experience.
Yeah, I'm from India, and I'm working as a registered nurse. Currently, I'm working in Maldives, and I have been working here since 2 years as a nurse. So this is my first experience, and in this section. So I enjoyed your class and your techniques. I'm so happy to tell you that.
Yeah, you are working in Maldives. Okay, there are quite a few doctors and nurses who are preparing with me. Yeah.
Yes, yes.
So
Actually, I got the link from this link from our group. So I just started today to focus your class.
yes, maybe one of our nurses or doctors might have put in the group the link. So that's very nice. So you can message me on my number, and I'll add you in one particular group. So you can. This is my number +919877867360. So this is my number.
Okay, sir.
9877867360. So you can just jump into that, and whenever I give free sessions, you can attend. Weekly one session I'll give, and a demo session, and afterwards after 2 sessions. So 2 sessions I'll give free for everyone so that they can understand how the classes are. Afterwards you can request for admission, and I will see if you have attended and you have participated. I know every student who is participating. So then based on the seriousness of the student, I'll give admissions. Okay, fine. That's very nice. Welcome for the session.
Thank
Then
you.
next, yeah, now one by one, this students who got the names, I have first winners. First winners. Yeah. Others, you type your messages. Yeah, who are the winners? Yeah, Manjula Ravi Kumar. Manjula Ravi Kumar.
Hi, sir. Good evening.
Yeah, good evening, Manjula. You got 6 out of 6. Wonderful. First, let me congratulate you.
Thank
That's
you,
really
sir.
very
I
nice.
couldn't
I
believe
actually
myself.
want to call you people on the video, but I don't know whether you are okay or not. I don't know which time of the day it is there. So if you are comfortable, you can come on the video and you can just share your experience. Otherwise, you can just talk in the audio. Whatever it is, no problem. Okay, fine.
Yes, sir.
Yeah,
So
share
your
your
class,
experience.
yes, sir, it was really very informative and the tips and strategies. Just I think 3 hours ago, I was just thinking, how will I do my part C listening? It's very difficult, and suddenly I got your message for the link. So when I joined, like it was just a prayer answered, and I was able to really answer part C. And I'm really very happy. Maybe my prayer is answered. And so I have one request, like, is it possible to teach medications names in part A? Because I feel the spellings are a bit difficult and the pronunciation.
Yeah, what you can do is you can write everything on a piece of paper, or you can type it and you can
Mm-hmm.
send the message to me personally. If you tell me,
Okay.
I'll be forgetting. So you
Okay.
can send to me personally, not in the group, in the personally, because in the group, many people will be typing many things and they will be going like that. So maybe they will be missing. If it is there personally, then I'll make a note of it and I'll definitely uh, answer your queries. No problem. Yeah, anything else you want to share? Your experience, you want to motivate our friends? How? Okay.
Yes, it's. I would like to motivate a few friends. I would like to send them the link if possible, maybe tomorrow, day after tomorrow, because few friends are planning to take the exam also.
Just
So
one or two sentences you can tell so that you are not directly motivating. You can share your experience after joining our classes, how you feel. Is there any improvement or not? How is the trainer? How are the sessions? How are the classes? How is the explanation? How is your improvement? So all these things, if you can tell a few words, maybe the people who are watching YouTube or somewhere here, they can just get to know me and attend the session. That's what I'm telling you.
yes, yeah, before I could join, before I could join Simon Sir's class, it was very difficult. I was really not able to trace any of the answers. I just started watching Sir's video on YouTube, and then I started following the link through somebody. And then once I got into his classes, like I'm a bit confident. It's been from January, I'm attending his classes. His tips, strategies have motivated me every time, even though I don't get scores sometimes, but I get few ideas like how I can improve the next time. So I always gave a good tips and strategies so that we can find the right answer. So I would like to recommend anybody who's really interested for seriously for the OET can join Simon Sir's class. You'll really be benefited out of it.
Right. Thank you very much for your feedback. And
Thank you, sir.
then Manoj. Meera Manoj, you can share your experience. Meera Manoj. Number 2, Meera Manoj. Okay, I can't unmute sir desktop. Okay, fine. Then next one is Pranita Pamarti.
Good evening, sir.
Yeah, Pranita, you can share your experience.
Thank you so much, sir. Actually, first time I got 6 by 6 because of
How come you get what 6 out of 6? I wonder, really, I wonder. Because you're in the initial stages and you're not even fully participating, but you got 6 out of 6.
yes,
Can you
because of your techniques. I am listening your classes, sir. So that's what I will apply like this. Really, I'm feeling I was applying. Really, it is very beneficial, sir. Actually, I'm not having confidence in me, but when I was listening your classes, really, I got very surprised. Thank you so much, sir. Really, nowadays I'm feeling
Okay,
very good, big confidence. Sir. Thank you so much.
right. Next, Constance Mafosa. Constance Mafosa. Yes, Constance. Hello, Constance Mafosa. Okay, she's not able to speak. Okay, next one. Adira Ajimon. Okay. Aruna Madhuriya. Aruna Madhuriya. Introduce yourself and share your experience.
Hello, sir. My name is Aruna and I'm from Uttar Pradesh. I'm actually looking forward towards to my reading list and listening test because earlier I have mentioned you that I have done my exam in January. Just because of getting 20 marks less, I'm just reviewing my listening and reading again over to this. Just finding out what is the strategy behind and those tricks and how much I can achieve in a correct way. So I'm getting some idea over to this right now, and I'm thankful over to your classes. And more of the things I will brush up myself again and again because practice makes you perfect in every way. So I believe I will consider further. But thank you for the session today.
Yeah, next Chaitra Gowda. Chaitra Gowda. Yes, last Chaitra Gowda. Right. Prem Gaikwad. Prem Gaikwad. Prem Gaikwad is mic is not available. Prem Gaikwad. Okay. Next one is Anastasia Kelechi. Not there. Right. Okay. Amrita Devi. Yeah, Anastasia Kelechi, you can speak. Why you were right? Yeah.
Good evening, sir.
Yes, dear. Yeah, you can speak.
Okay, it has been a wonderful section. As you can see, I'm always afraid to see, but today, with the strategy I used, you thought I'm able to get 5/6. I'm happy for that. Thank you so much.
Yeah, welcome. So next one is that Amrita. Hello, Amrita.
Yes, sir. Good evening, sir.
Yeah, good evening, Amrita. Yeah. How do you feel regarding this session?
Sir, it was very grateful and beneficial. And before this, I couldn't get these tricks. And I'm thankful to you that today I got how to uh, achieve score in shortest time. These are very beneficial, sir. Yeah.
Yeah, that's very good. Thank you all. So fine. So see you tomorrow. Tomorrow we'll focus on reading. Part A and part B. Day after tomorrow we'll focus on part C. Because I don't want to teach fat like that one. Slow and steady wins the race. Okay. So if we have concentrated everything, part A, B, C, everything on one day, it will be difficult. So tomorrow we'll see part A. Then day after tomorrow, part B and C, the reading. Okay. So we can do like that one. Right. So that's it. So that's the end of the show. Have a nice day. Good night. Bye bye. See you all. Yeah. Normally we start at 9 o'clock, 10 o'clock, 11 o'clock. In between these 2 hours, like that one, we will be starting. Tomorrow, 9 p.m. we can take. So if anybody misses the session, you can let me know. And personal sessions, you can always request me. That's different. Yeah. Fine. That's okay. So we'll be joining soon. That's